Today's speaker is Gianna Petrangelo. Gianna is from West Warwick, Rhode Island, and is graduating with a Bachelor of Science degree in nursing. Please come to the podium. Thank you.
Hi, everyone. I'm very happy to be here. Good afternoon, faculty, families, friends, and fellow graduates. It is truly an honor to stand here today representing this incredible group of graduates. My name is Gianna Petrangelo, and I'm from West Warwick, where most people knew me less as Gianna and more as one of the Petrangelo triplets. My sister was one of those students in high school who seemed to collect leadership positions, cords, AP credits, and awards like it was a competitive sport. Truly, she was the whole package. And now she has 2 years left in URI's PharmD program. And to put it simply, my brother and I weren't exactly the overachiever type in high school. He went on to become an electrician, and somehow, I found myself starting nursing school here at URI. And I remember looking around at all of these students who reminded me so much of my sister in high school and realizing these people actually do the assigned readings before class. And honestly, at that point, I was just hoping I could survive long enough to make it to the day I officially got to wear the URI nursing scrubs. And when that day finally came, I woke up way too early that morning, threw on those bright royal blue scrubs, and of course my mom made me take a picture at 6 a.m. before I left the house. I walked in nervous, trying to do everything right, thinking if I just followed the steps of my head-to-toe assessment, I'd be okay. And within my first shift, I got punched in the face, which at the time felt like the worst possible start. But looking back now, I think it was a pretty accurate introduction to nursing. Because over the last 4 years, I've realized that no matter how much you study, prepare, or try to get everything perfect, there will always be moments that catch you off guard. And somehow, between all of those moments, we got here. Looking out at all of you today feels a little strange not seeing everyone in our usual seats at the Rhineck with our laptops open, trying to stay awake through our 8-hour lectures. But for all of us, today represents 4 years of being pushed, challenged, and honestly, just trying to figure out things as we went. And while all of our experiences look different, I think there's one thing all of us shared. None of us got here by having everything figured out. We got here by learning, adapting, and continuing forward even when things felt difficult. When we first came to URI, a lot of us thought the moments that would define these 4 years would be the big ones: passing exams, starting clinicals, and walking across this stage today. But what actually shaped us were the moments in between, the ones no one really sees. Standing outside a patient's room, going over everything in your head one more time. Double-checking your meds, even though you already checked them twice, and then checking them again one more time just in case. Walking into conversations you didn't feel prepared for. Sitting with patients and families during some of the hardest moments of their lives, and realizing your presence mattered even when you didn't have the perfect words. And suddenly it hits you. This isn't a simulation anymore. There's no pause button, no instructor stepping in, no one standing there telling you exactly what to do. Someone is trusting you before you fully trust yourself. And I think that's one of the hardest parts of becoming a nurse. Because over these past 4 years, it was never just about learning skills or passing exams. It was learning about how to walk into moments that felt bigger than you are, and still choosing to show up for people anyway. To speak up when something feels wrong, to stay calm when everything around you feels chaotic. And little by little, those moments start to add up. Because nursing isn't always about feeling ready first. It's about learning to walk in anyways. And over time, you stop waiting to feel completely confident first. You still ask questions, double-check yourself, and have moments where you're unsure, but you walk in anyway. And somewhere along the way, without even realizing it, all of those little moments starting adding up. The early mornings, the long clinical days, the group chats that carried us more than any textbook ever could, the 8 a.m. lectures we definitely weren't fully awake for, and Kaplan questions that made us question not just the answer, but our entire existence. Like choosing between two answers that both seemed right and then reading the rationale and realizing neither one was. And somehow, after all of the stress, the exams, the clinicals, and the moments we thought we couldn't handle, here we are graduating. Getting ready to take the NCLEX, still not totally sure what to expect. I'm just hoping it's in a good mood the day we take it. But I think somewhere along the way, we learned something bigger than how to pass exams. We learned how to keep showing up, how to walk into situations before we feel completely ready, how to trust ourselves even when things feel uncomfortable, and how to care for people even on the days we doubt ourselves. Because at this point, whether we realize it or not, we're capable of more than we think. And honestly, if I could get punched in my face on my first day of clinical and still come back the next shift, I think we're all going to be just fine. To the people who got us here, the ones who believed in us even when we weren't always so sure of ourselves. To our families, for every late night, every early morning, and every moment we questioned if we could actually do this. And to my mom specifically, stand up, Mom. Come on. Thank you for always believing I could do this long before I fully believed it myself. You taught me what it means to be a strong, independent, and resilient woman, to work hard, show up for the people you love, and keep going even when things feel impossible. Raising triplets sounds like my worst nightmare. And somehow you still made it look effortless while also giving us the world. Everything I am is because of you, and I'm sure you want to sit down already, so I love you. To our friends, the ones who studied with us, listened to us overthink absolutely everything, and somehow made even the hardest days a little bit easier. To our faculty, mentors, and clinical instructors, thank you for pushing us, challenging us, trusting us, and giving us the space to grow into ourselves. Thank you for teaching us not just how to pass exams or perform skills, but how to care for people during some of the hardest moments of their lives. And to the simulation actors who made learning feel way too real and definitely triggered a few Apple Watch high heart rate alerts. And of course, this is very special to me, to the IT team at Rhineck who somehow showed up to every single class just to get our PowerPoints on the screen. They honestly deserve an honorary degree at this point. Thank you for showing up for us so we could learn how to show up for others. And as we step into this next chapter, I hope we carry that with us. Not just everything we've learned, but the people we've become because of it. And now, somehow, we're the ones walking into the room, not as students anymore, but as nurses. Congratulations, class of 2026.